Good afternoon. We'll continue with our second panel today, our final panel. It's focusing on peer recovery, the role of the clinician in treatment. Again, thank you, Dr. Barton, for moderating this distinguished panel, and I'll let you take it away. Thank you very much.
Let me see. I'm looking at the room to see who's back. Welcome back, and I just want to thank you for allowing us to share this time with you and to try to have these discussions that can be painful. Earlier, I spoke about what would you do if this was a family member, right? And one of our questions that was asked is, why don't we have individuals be a part of this that has lived the experience? We do. I'm going to have you meet her soon. So the panel comprises of Deborah Ayabusi. I said your name wrong, even though I did it right the first time. From Health and Human Services, Danielle Bransford from the Peer Recovery Crisis Center, and of course, LaTanya Rich, the CEO of Tree of Hope. I'm going to have to start with you because I want you to share your lived experience.
Hello, I'm just getting over laryngitis, so excuse me. But this being here means a lot to me. I am a prior resident of Takoma Park. I lived at 123 and 126 Lee Avenue for 15 years. I'm a person with lived experience, and I spent the last days of my addiction on Lee Avenue. So I understand what the struggle is in this community firsthand. I was able to, once I got clean, my life changed, things got better, and I was able to get me and my children away from Takoma Park. Sometimes I feel like there was two, like everybody was so wonderful, the community's so tight, everyone's really nice, but there's a divide, like this sector where the apartments are, there's a lot of poverty here, right? And for you guys to finally do something that addresses the disparity in this community means a lot to me. And like you said, I can hardly talk, but it was no way I was going to miss the opportunity to do this. So as a direct result of me becoming into recovery, right, my life has been service-driven. I was really grateful to be given another chance, right? And so I spent most of my days helping individuals figure themselves out that came in after me. So the peer movement came. My husband and I, another gentleman named James, we decided that the peer movement was the answer to all the work that we had been doing for free, right? So we got trained. We trained ourselves. We had a little bit of money. We went to Connecticut, became certified facilitators, and we bought peer services, real peer services, here to Montgomery County. So fast forwarding, there's been a lot of struggle in between. We started in 2012. We did not get funded until 2022. I work for a Maryland Treatment Center, supervising the STEER team, which is the opioid crisis intervention team for the county. And that team was so successful, right? During the pandemic, though, programs shut down. We weren't able to access beds, so I started a town hall meeting. I invited like 8 programs that we use on a regular basis to report out what the protocol was. Sometimes it was women this week, men next week. Sometimes we're not accepting any admissions, wherever. We met every week for 18 months. After that 18 months was over, things started opening back up again. Today, that listserv is now almost 600 members of peers and programs in Maryland, D.C., Virginia, Pennsylvania, and Delaware. And we work as a team to ensure that nobody's left behind. But prior to the pandemic, it would take us 3 to 6 days to secure a bed. That was normal, right? Because of this listserv, we can identify multiple beds in 20 minutes and have people on the way to that bed within the hour. we just broke it. You know what I mean? I love it. But the county wanted a piece of it. And I was like, I'm not giving y'all nothing else till y'all give me my money. And that's what happened. The RFP came out, and we opened up the very first substance misuse drop-in center. All the other drop-in centers are mental health. They thought we were the same community, and we're not. So we were able to open up the very first substance misuse drop-in center. Since then, I now house the steer team under our umbrella. We have the adolescent clubhouse there, which is amazing. I invite anyone to come do a site visit. But we also have the community center for the adults. And it's amazing. We're in 18 high schools. We're in 3 middle schools, doing one-on-one peer mentorship, helping people who are struggling to get clean, set goals, and figure themselves out, and helping people who are on the other side and coming out of treatment figure out what their next steps are, and making sure that all the resources that are available, they have, right? And we've been doing this for a very long time. So our success rate is pretty high, our name is pretty good. And I'm just proud to be a part, to be chosen, to be a part of something that touches so many lives, right? This was gonna happen anyway, but I've been tasked to do it, and I'm just grateful for the life I live. So I don't work, right? I go have fun every day. I yell at my employees, they yell back at me, and we just have a good time, right? I never thought my life would look like this. I didn't think I'd live this long, right? So, but anyway, I know I'm going to
No,
tangent.
I just wanted to
Yeah.
say, you are the reason that I created I See You Shine. Because it's that opportunity that you get. And you did an amazing thing with it. Your lived experience is now helping someone else. And tell me a little bit about, you talked about 3 different parts to your organization, the STEER,
Yeah.
the community center. What does each of those parts do?
STEER is the crisis intervention team for the county. We respond to EMS, fire and rescue, crisis, and individuals who've been referred before. And they're a 24-hour team, so it was 3 a.m., 3 p.m. If a person has an overdose, goes to the hospital, our team is just deployed to that hospital, offers treatment, gets them a bed to bed. If they say, I'm not going to treatment, but I like talking to you, they will follow them for 6 months anyway. They have a really high record of, after a couple of months of engagement, that individual chooses to go to treatment anyway, right? So that is Montgomery County's crisis intervention team, even though we hold a contract, right? That's what they do. They create relationships and make connections with individuals to give them the belief system that they can change their lives, right? They're the example. 90% of our staff have a lived experience.
And how do they get in touch with you?
Okay, I forgot the youth team. We also have a youth team, Next Gen Youth Team. They go there in 18 high schools. I think I told you that already. And they also manage the clubhouse. And we also train peers all the way to state certification.
So what do you do in with the teens? That
teens,
group?
those groups do
What does that look like?
They come in, they get one-on-ones as well, wellness plans, but they also have recovery groups, trauma groups, smoking cessation. There's a sexual health group that happens once a month that includes testing, syphilis and HIV testing. And also we do, Department of Labor comes in once a month, and they help them get like maybe internships, getting in training programs and things like that, because a lot of our kids are near 18 and are thinking about their next steps.
So before we started, we were having a conversation, and we were talking about the different people and the different things that they need, and you made a very powerful statement. You said it's a family affair.
Yes.
So I want you to share what that meant.
The reason why I say that is like a lot of times I feel like we as individuals become very hyper-focused if one thing happens. And so our kids are in distress right now. So everyone's hyper-focused on kids. But what we forget is that these kids have parents that are dysfunctional. If we're not holistic in our approach, it can't all be about the kids. It has to be about the family, because you put a kid in treatment, get them in a good space, and you put them back in the same house, it's just going to happen again, right? So until we can like broaden our lens and look at the entire family, figure out what resources the family needs so that child can have a more healthy environment to return to. Maybe the parents need to go to treatment. Maybe there needs to be some mental health services for the family in general. Maybe it's just food and hunger. You know, we have some kids that were dealing drugs that did it because their siblings didn't have enough food to eat. You know, so there's so many reasons. Unless we ask good questions, we treat the individual, then we're going to be spinning our wheels constantly.
So I know I'm focusing on you. I'm going to get to you guys, I promise. But I did have a question for you. What are some things that you look for as a parent in your child that could be going down the road of that stress, that distress? What are some of the things would you say to look for?
I say attitude changes, more rage. I mean, outside of the normal teenage rage, you know what I mean? Lying a lot, not coming home, being very secretive. Like I said, it's an individual thing. Some kids, you know, I know a kid, they never knew that he was doing anything because he was an honor roll student. He was doing everything right. But being able to open up communication with your kid, have them talk to you about what's happening in their lives. Look at their friends. What's happening with their friends? A lot of times, you know, kids say, well, that's just Bobby, but you with Bobby every day, right? So being able to just dig in a little deeper with connecting with your child is sometimes the only way you will know, right? Yeah, but behavior change, lack of motivation, I think are the two biggest things.
Thank you. So I'm going to move on, but I'm going to come back to you, I'm sure. Deborah, I need for you to say your name correctly because I butchered it the first time.
My name is Deborah Aigbusi.
And Deborah is with Health and Human Services. Tell me a little bit about what it is that you do and what motivated you to get involved in this.
Of course. So I'm located at the Montgomery County Crisis Center. We're located in Rockville, and we're available 24/7. We don't close. I specifically are one of the 3 child and adolescent therapists that we have there. So we have a program essentially within a program. It's called Child and Adolescent Assessment Services. So we do a full comprehensive mental health screening along with a substance use screening as well. We're able to do urine analysis to see what potential substances are currently in the adolescent's system and go on from there and make the proper referral. We refer to Tree of Hope quite a bit. We refer for education, intensive, outpatient, inpatient, whatever the client needs at that time. We specifically see people 18 years of age and younger.
Okay. And I know I asked you this question, but I can ask everyone on the panel, how does the person get in touch with you? Is it through 911 or what does that look like?
No, so being that the Crisis Center is open 24/7, we have 240-777-4000. We also have cards at our table if you can grab one of those. We also have several partnerships across the county as well. So we see school referrals daily at large. So we have a partnership with MCPS. Specifically for CAST, we get a lot of referrals from CPS, Department of Juvenile Services as well. So a lot of times it's about word of mouth. A lot of times we do these outreach events so that people can know like the programs and the services that we have available, because it's hard to know. There's a lot within the county, but if you don't know, you kind of don't know. So.
And if you could say one thing to our audience about what you do and for them to understand that that service is available, what would you say?
One thing is kind of hard, but
Say as many as you'd like, but
kind
share how the importance of this.
yeah, it's really important. Just because Latana was just saying, it's kind of hard to notice changes in mood and behavior because kids can be pretty crafty when it comes to either their substance use or even if they're engaging in self-harm. So it's really important to know who their circle is and what's going on with them. Another big part of what we do are risk assessments. So we're checking for any self-injurious behaviors, suicidal, homicidal ideations, and even screening for hallucinations as well. So the work we do is really important. Honestly, there's a lot going on in the world, and the children are definitely impacted. And I think in this current generation, they're kind of having a hard time regulating their emotions and leaning towards on healthy coping skills rather than maladaptive coping skills, whether it's self-injurious behavior, picking up substances, whatever it is. So we're available. I can't stress that enough. CAS operates Monday through Friday, but you can come in at any point and speak with any therapist, and we're willing and ready to help.
Thank
Yeah,
you.
they're amazing.
Danielle Bransford, tell me about yourself and what you do.
Okay. So my name is Danielle Bransford. I also work at the Crisis Center. I am a certified peer recovery specialist through the state of Maryland. And I also want to say I am a product of Tree of Hope. LaTanya was my mentor, right? And because of the work that she does, I'm able to do the work that I do for the county. And what we do is mobile crisis. So predominantly what I do is I ride around with a therapist on these mobile crisis calls, and we come to evaluate and assess whatever that situation is. So if the therapist needs to eep, somebody, send them to the hospital, then we do that. But if somebody is too drunk, too high, that's where I come in. I can offer them resources. I can give them my phone number so that they can reach me at a later time. We also do some outreach. We give out blankets, Narcan kits. We do all kinds of things. You can also call the Crisis Center to talk to a peer specialist if you are having, concerns about substance use, right? You can connect with us at any time. Maybe not me personally, but if you call the Crisis Center, you can get to one of us, Are there any other questions?
Yes. So the answer is yes. So it would be the same process to get in touch with your group.
Yes.
Okay. So back to you, Ms. Rich. Are there other organizations that you partner with?
Partner with everyone. Partner
Other
with-
than the school
I
system, do you partner with
CAS.
churches?
I partner with
Crisis, yeah.
the Crisis Center. I partner with Fire and Rescue, EMS. We partner. I'm actually the co-chair for the opioid prevention team for the county, under the medical health officer Keisha Davis. I partner with everybody. So yeah, like all the treatment centers.
Everybody.
I'm not, like, am I lying?
No.
Okay.
Not at
All
all.
right. And so any way, one of the things that I understand beyond a shadow of a doubt is no agency, no program is the solution, right? So in order to be able to help a person, we need everybody. So if I need something and, and CAS can help me get this person, maybe they need documentations to get into a program, I'll send them to CAS, they'll do the screenings, they get in. I might have, it might be a person that wants to have therapy. I'll call a few therapists that I know, I connect with them. I'm connected with so many programs. That's why there's 600 people on my listserv, right? Because it's holistic. I partner with just about every agency in this county
What are you seeing most of?
in regards to.
Not necessarily addiction, but incidents. Like you were talking something about there's more alcohol. you see more alcoholism?
Yeah, well, you know, that goes with the tunnel vision thing, right? So a lot of times, when the opioid crisis came, that was because young kids were dying. It became an opioid crisis. But the reality is, since I've been working in this field, I'd say 75 to 80% of the referrals that we've ever gotten annually has been alcohol, right? So the crisis is that people are dying, but people can die of alcohol too, right? But it's just the tunnel vision. We are a recovery community center. We do whatever it is, even if it's glue,
Yeah.
right? It's just as important as the rest of it. At the end of the day, it's not about the substance, right? It's about what's behind it, right? So whether it's glue or whether it's opioids, making the connection with that individual gives them an opportunity to change their lives, for them to change their lives, because I don't do anything, right? I create opportunities for other people to save their lives, right? Whether they take the opportunity or not, it's up to them. So I can be just as successful with an opioid person as I can with a crack person, as I can with a glue person or a marijuana person. But the drive, me being able to make a connection, the people that work for me, the ability to make a connection with that person to hit here could mean the difference of that person, you know, seeing themselves in a different light.
So I'm going to ask anyone who wants to answer. What do you wish more people would understand about naloxone, particularly people who might be resistant to carrying it?
You could save someone's life.
And just to ask, has anyone taken the class, the naloxone class already? Okay. Are there any questions you would like to ask the panel? Because this is knowledge right here. Someone added a question earlier.
Oh, I have something that I want to say about the Narcan thing that most people might not be aware of, is that if you are a loved one and your loved one passes out from an overdose and you do the right thing and you administer the Narcan, right, that person still needs to go to the hospital, right? A lot of people don't know that, and a lot of people don't do it, you know what I mean? But the risk is, and I've seen it happen a few times, that person will come out of that overdose, go to sleep and not wake up again. They'll go right back into an overdose, right? So they really need to go back to the hospital, even though they've come out.
Because the science behind it basically is it's a receptor, the opioids or the bad guy goes, so you start having problems breathing, right? And here comes Narcan or naloxone, the big bad guy, and he beats it up, and only for 90 minutes, 30 to 90 minutes, that's the length of time that stays in your body. So you have enough time to get to the hospital. They will put you on a Narcan drip until the bad guy comes out of your system. That's the simplest way to describe it. But if they go home, they'll re-overdose again, and they will die. Because what happens, it's the ability to breathe. When you have an opioid overdose, it's that ability to breathe, right? What else about Narcan? That it's not, if you're expecting, you can use it. There is no contraindications for using Narcan. If it's not an overdose situation, it won't harm you. So that's also good to know.
Well, the other thing to know is you can come into our office at any time, walk in and get Narcan. We're an opioid response program.
The crisis center too has naloxone kits.
So I do have a question. I was hearing that there are law enforcement agencies that actually have a safe place for people to go if they're in crisis, dealing with, if they're using, in some counties. Is that happening in Montgomery County as well?
No.
Wait a minute.
I'm thinking maybe you're referring to stabilization.
That's right,
We
crisis
have it.
stabilization.
Yeah, so we're a big building in Picard Drive, and we have a lot of other, county programs within us. So there is a crisis stabilization bed. There are 4 recliner beds. So a lot of times, law enforcement will bring in somebody that might be high on a substance, or
Okay.
a lot of people will get referred to us after they've been discharged from the hospital, and they do have a nurse on shift, so they're able to monitor the person, make sure that they have what they need, they're fed and things like that. They do have to give up like their cell phone and things like that, and I believe it's kind of like a 24-hour thing, and during that period, they'll work to get that person connected to their next level of treatment, whether that's residential, outpatient, whatever it is, but it is completely voluntary.
Yes.
And if the person maybe, because we're not a hospital, essentially we have a nurse there, but maybe if they're in a bit of a higher need, then they would be, referred out to a hospital.
Okay,
But, yeah.
so the reason why I asked that is because I know that they're doing something similar in Anne Arundel County, and
You're
the,
talking about a safe using center?
the safe
That's
using
what they're
center.
talking about. That's what I said, we don't have that
Well,
here.
crisis that's helpful too, but.
Yeah, but
Yeah,
there
it's not
are
a
different
safety center, no.
resources
We don't have
out there
a
that if
safe-
you
Yeah.
don't ask these questions, you would never know, right?
Yeah.
And I think one of the goals is to allow people to see that we're here to help. You don't have to be afraid of asking for help or without being locked up, because that was a big thing. So that's one of the reasons why they created the
Samaritan?
the Good Samaritan law. And I spoke about that in the earlier presentation. There are 6 misdemeanor crimes that you are not, no officer can charge you with those. And it's like underage drinking, finding some paraphernalia in the house. So, because what was happening is kids were dying because they would not call the police until they cleaned up whatever they were using. So people were dying. So the Good Samaritan law came in effect to prevent people from, well, to encourage people to call the police. You're gonna get the help you need. If it's a medical emergency, you're gonna get the help you need without fear of being detained, right?
What I will add, though, is that there is a harm reduction department off of Goody Drive, where people can come and get wound care. There's nurses there. They can get needle exchange, and they can get whatever services, paraphernalia, clean works or things like that. So there is a place for that. The wound care part is really important because a lot of times they don't end up in the ER until it's festered to a point where they have, irreparable damage.
So some, in the earlier panel, they discussed the fact that there were certain medications that you'd take that would cause the skin to break out, and they wouldn't take you in the centers when you go for recovery. Do you know what drug that is or what that's connected to?
Oh, she's talking about crocodile. That never really got here. Is that
Yeah.
some of the drug?
Crocodile, yeah.
Crocodile was it was eating flesh.
Yeah.
I've only seen one person in Montgomery County
Okay.
that had that, and I think he came to treatment here from another county. I don't think crocodile actually ever got it here. The drug now is metatomidine. That is like, this is like a horse tranquilizer. It's stronger than crocodile, but it doesn't have the flesh-eating effect. And that's what's coming now. So we have in our center, we have Narcan, we have fentanyl testing strips, benzo testing strips, but we also had metatomidine testing strips. And I can tell you that most times these testing strips aren't used by people who are actually using, but they can be used by loved ones, right? They could be a drug test, you know what I mean, to detect any drugs, but that's unofficial, but that's what a lot of our parents have done. But it can save a life, right?
So to identify, I'm going to go a little deeper on identifying different types of drugs that has the opioid piece to it. Does anyone take pain medication? Okay. Has anyone ever had a dental procedure done? Okay. a lot of those medications that you get when you get your wisdom tooth pulled is going to be something with opioids, with some form of opioid in it, right? Oxy or one of those other things. If you've ever had major surgery, my recommendation is if you have any opportunity to use anything that's an opioid-related product, make sure you have some Narcan at home, because accidental overdoses happen. We're not just talking about someone who has an addiction problem, we're talking about an accidental overdose. That happens more than you know, because you could take that Oxy and you feel good, and 20 minutes later you forgot that you took it, and guess what's gonna happen? You're gonna overdose. So a lot of times now doctors are actually, after surgery, they're sending you home with Narcan, right? There was a nurse in the room earlier. Am I correct about that? Most hospitals are doing that now?
Sometimes patients find it's hard to get at pharmacies because the insurance doesn't cover it, so it's all the time. I used to work in a surgery office, and it was prescribed. Patients, nobody explains to them on discharge why we're prescribing it, and then when they get to the pharmacy, a lot of times it's not covered by insurance, and they don't get it, and then it stays on their med list forever, but the opioid falls off, and it just kind of causes some confusion.
So the good news is now you can literally find Narcan
Free.
Yeah.
at many different locations. Can you give
Yeah.
us some ideas of where they could?
I can, well, you know, the Crisis Center, Tree of Hope, but some pharmacies do give it out. We can get a list. You guys should have a list, right?
I don't believe I have a list, but I mean, like we said, the
Yeah.
Crisis Center, harm reduction, and I believe
Yeah.
most pharmacies now are giving out Narcan for free.
Yeah, the local
There-
Behavior Health
Yeah.
Administration has a list of those people. But one thing I wanted to mention is that above that situation is that I can't tell you how many people that end up in the ER from an overdose state that I used to be a Star Trek player, or I was just a little old lady and I had a surgery, right? And like, you don't know you're addicted until it's too late, right? So being able to, if you are prescribed an opioid, being in close communication with your doctor to wean you off of it, to like literally detox off of it, if you're gonna be on it for an extended period of time, is mandatory. Because once that happens, you're gonna be doing things that you never thought you'd do, because the sickness. And it's not that you're a bad person, it's that your body is addicted to the drug. That's a lot of people's story in recovery. A lot of people, just they innocently had a surgery or a procedure.
And for anyone that is going through addiction, once you've overdosed once, it's a lot easier to overdose, right? And if you are still using, just remember, have a game plan, because it's better to save your life than live in secret, right? We got to get rid of that stigma. So if you are using, because addiction is addiction, it's an illness, right? If you're using, make sure you have an opioid response. And I know you guys tell that to your clients,
Most definitely.
because we're not gonna pretend like we don't see it, right? We're not gonna hide our head in the sand and have our loved ones die.
That's right.
It's about having those courageous conversations. Does anybody have any questions for the panel?
I can kick it off with a question, Doctor. Related to peer recovery work, I find that fascinating, and I'm somewhat not well informed on the actual work. I would imagine the skill set required to do that work, which I consider, frontline, kind of, very client-centered, would require a special person to be effective at it. So Danielle, can you explain what brought you into that role and how you navigate that day to day, which must be somewhat of a burden?
I'm a person in recovery, long-term recovery. So I got clean in 2017. And it was a very long road, okay? It was, LaTanya knows this very well, 42 treatment centers, 27 years and 42 treatment centers is what it took me And the reason it took so long is because I had complex PTSD. I had trauma, right? And so what would happen is I would get clean, and then it felt like 100 emotions attacked me at one time, okay? And I didn't know how to handle that. So the only way to deal with that is to quiet the noise again by using, right? And so I was stuck in that pattern for a very long time. It wasn't until somebody said, you need trauma therapy, right, that I actually went and got trauma therapy. And things started to improve as I developed the coping skills necessary to quiet my mind, right? The biggest issue for me wasn't just putting down the drugs, because that's just a symptom, all right? The biggest thing for me was understanding that my thinking was the problem, and that the way I was handling my life every day was a problem, right? I thought it was just the drugs. And when I put the drugs down, I found out I had a thinking problem. I have a feeling problem. When I feel too deeply, I tend to use, right? And so what I try to do in my role is educate people about what's going to happen to you in early recovery, right? Because what I find is that as I work with addicts and alcoholics and they come into recovery, what happens is about a month or two in, right, post-acute withdrawal syndrome kicks in, right? Or some other emotion kicks in that they don't know how to handle, right? But if you're prepared, if you know that these things are going to happen to you, right, then you are better prepared to understand that my recovery is working. It just doesn't feel good right now, but it's working, right? And they need to know that because they're unaware that this is happening to them, right? The other thing is the stigma that's attached to it, the shame that's attached to it. I would suggest if you're approaching somebody about a substance abuse problem, try to have no judgment, right? Because I am a recovering addict, and I'll be honest, when I was in the hospital, if you showed the least bit of judgment to me, I shut down, right? So when I go to addicts and alcoholics to talk, the first thing I do to disarm them is tell them I am a person in recovery. And so you don't need to worry about me judging you, okay? I'm just gonna talk a little bit about where I was, and I'm gonna try to help you get to where you wanna be. That's it. But it does take a cognitive skill set. Like, you have to understand kind of what's going on. And peers are trained in mental health and addictions and ethics, and I can't think of all the things now.
Professionalism.
Yeah, professionalism, basic first aid, mental health first aid. We are trained in all of these things. And when we have to go to the state, we have to take a state board to pass these things, right? We also have to do 500 intern hours. Under somebody else. I did mine through Tree of Hope.
And they have to do ethics every 2 years.
Yes.
They have to requalify every 2 years to make sure their training's up to date.
Absolutely. So that's what it takes for us.
Thank you.
That's amazing, because you are now the expert, but you've had the lived experience.
I do.
So that's the connection. That's what makes it more powerful, makes it more effective.
Yeah, well, one of the things I like to say as just a self-esteem thing, right, is that I have the education it cost me, was painful, right, but other folks can't necessarily get that experience or that education, and thank God, because I wouldn't want anyone to go through that. But the experience that I have is invaluable.
That's right.
Thank you so much for sharing your story, Danielle. I wonder how you and other people on the panel, how do you take care of yourself when you hear other people's stories? As a nurse, I know I can get really drained. As much as I want to help people, it is really draining. So how do you take care of yourself?
So for me, self-care is critical. If I don't take care of me, I definitely can't help you. And so the more I prioritize self-care, so what that looks like for me, I am in therapy. I stay in therapy, okay? Because like I have a thinking problem and I have an emotional problem. And so at any given time, this can kick up. I refer to my disease in third party. So I call her the bee. I won't say the whole word, but I call her the bee because it's really like having a persona, all right? Alter ego per se, right? And so for me, it was really helpful to name that. Right? And I named her the bee, right? Because what I understood was once I put the substance in me, my thinking changed, right? And so it would look like I'd be going to the store to get some milk for the kids, and I would end up at the dope man's house. So the disease has a mind of its own, right? And so when I'm getting clean, I need to understand that the disease has a mind of its own. This is where the network comes in. This is where you build your community, because you're going to need that community to get through the everyday life problems. That's the problem. I don't know how to get through everyday life. Each situation that hits me, my emotions are overwhelmed, right? Because when we first come into recovery, we have been numbing our emotions. And so when we get clean, it looks like 1 and 1 equals 5, okay? That's how we feel it. You know, and so if you could just understand, if a person is new in recovery, they are feeling 10 times what we normally feel on a regular, right? And so getting used to feeling those feelings and working through life is what we're really trying to do with new people in recovery, right? And understanding that just because your emotions are all over the place doesn't mean that you have to use. You can call somebody and connect. You can call, you know, you can call the Tree of Hope and connect anytime. You can call the Crisis Center, ask for a peer, and connect anytime. If you need to talk to a peer, you can call places like we have and connect with somebody who has lived experience in what you're talking about.
Yeah, and I also want to say, like, for my staff, like, they know self-care is a big deal for me. We have weekly check-ins, like, everybody knows everybody's business. So we do a weekly, like, wellness check-in. We make sure that, like, we know what's going on with individuals. We know what the struggles are, and we're accountability partners. Like, we try to keep a family environment, because one thing I understand is, like, what Danielle was talking about. Like, we've lived lives that would be trauma for you. It's just a matter of course for us. We've been through so much that we don't see it as trauma. But I call them micro traumas. Over time, I know we had a young lady who had a call to Suburban Hospital, and the girl had a baby. So when she got there, she realized that the baby was stillborn. But, like, now they don't take the baby out the room; they put it in the bassinet. And my peer went to the bassinet, picked the baby up, helped her dress the baby, right? And she's like, it was fun, but you don't even understand that that's trauma. You don't recognize it as trauma. So for in the new year, when I get the money, I built money in to have a therapist come into the office to attend once a month, to do group therapy and any one-on-ones. I do have a nurse that works with us. She actually did the parents group for Avery Road for a long time to do, they can call her anytime, right? If they need to talk about something, they need to do anything, and I definitely, most of my staff is in therapy. They get sessions. There's a back office that nobody uses. It's the therapy room. They go, if the kids go back there, the staff goes back there, and they'll do their 1 hour therapy, whatever time that might be. So, because I do know the importance of this job is led by the heart.
Yeah.
You can't do this job well if you don't care about it.
And that's amazing, because you being a nurse, you go through trauma too, because there are a lot that you see. So, and me being a police officer, I have a therapist. I'm a therapist, but I have a therapist, because you need that space where you can safely unload all of the pain that everything that you take on from someone else's pain. You need that vicarious trauma is real, right? So that's why, that's one of the things, self-care is so, so important. I gotta commend you guys, because you're taking in a lot, right? You see it, you hear it, you feel it. You get re-exposed to some things that are even more personal. So that was a great question, asking how do you navigate that?
Yeah.
And for you?
Yeah, I would like to speak to that as well. So I'm a licensed clinical professional counselor in the state of Maryland. I think as a therapist, it's important to have at least experienced therapy yourself. If you think you're going to be effective in that way. You guys have spoken a lot to vicarious trauma, so that's acquiring trauma yourself throughout and when somebody has experienced a trauma, there's also countertransference. We're taking in a lot, so you need a place to just let those things go. Something that's really important for therapists is supervision. There's one-on-one supervision, there's group supervision, consulting with your colleagues, just taking a load off. If we have like a really just huge responsive MCT or SISM critical incident that we went on, it's really important that when we come back to the office, we check in with our supervisors. You take time off when you need it. I think that's the biggest part of self-care for me, knowing when to take a step back. Because if I myself am not well, I'm not gonna have much to pour out to and give to clients. Okay.
Now I don't feel bad because I did that earlier today. So we've all done it.
Yeah, sorry.
Does anyone have additional questions?
So, your question? Let you go first. Your question is probably better than mine.
No, it's probably not. Hi, everyone. I am Mayor Talisha Searcy for Takoma Park, and I'm really, really, really excited to have you all here. In my other life, I've worked for SAMHSA, and I currently work on behavioral health IT initiatives for HHS. And one of the things, just picking up on Danielle, your point, what I have been hearing from the field is, to the issue of trauma, but also workforce, the number of people that we have that is doing this type of work. And having the peer recovery support specialist is critical in filling a gap. Are you all also seeing that we are in need of more practitioners in Montgomery County? That's what I'm hearing across the country. And so, what are some things that we may want to start considering in terms of trying to encourage more people to go into this line of work? Because as people are becoming more self-aware, we have 988, we have all of these other avenues for people to get that help. And Danielle, to your point about making sure people understand to not just the stigma is important, but I am constantly having to remind people that co-occurring substance use disorder, mental health those co-occurring conditions are really, really, really critical for people to understand that they're intertwined. And I've seen from a federal policy space, it's a lot more accepting in terms of the mental health, but the substance use treatment piece typically gets a lot more of a bad rap in terms of policy and resources. So what are you all seeing in terms of workforce? And then what are some things that we can all start thinking about in terms of try to filling that gap, how we may be able to advocate in this space at the state level and at the federal level to really make sure that you all are getting those types of resources that you need?
I can speak to this a little bit as a provider. There's a huge gap. I think a lot of times people get frustrated when we do referrals. They, want treatment right away, and the reality is the wait lists are just huge. And the providers that are available were burnt out, right? So I heard people speak to it on this panel that this is not the type of work that you should get into just for, just for giggles or money. You definitely have to be called to the work.
Yes.
And I think even the process of the training that we have to go to, it's extremely rigorous, right? It's 3,000 clinical hours. It's 100 hours of supervision. In some states, it's 200 hours of supervision. It's school, it's years of school, student loans, so it probably doesn't sound appealing as I'm talking about it. So I think what we can do is make the field less restrictive to get into in the first place. Because not everybody is going to have access to education, even the license processing, it's a lot. It's a lot of money, okay? It's a lot. So making it less restrictive so that people that do feel like they have the calling on their life and they want to go into being a service provider, they have the accessibility to do that, because it can feel very far in between if you don't have the money, if you don't have the generational backing, it's hard to get into.
Yeah, I would say, yeah, that's definitely true. We have being able to also use like the resources that are already available too, right? Because there's community resources that already exist. We need therapists, but the thing is, right, most of the therapists that I know that work for the community supports, they work in 3 jobs. You know what I mean?
Yeah.
So like after getting into all that financial debt for their education, they can't, they have to work 3 jobs to pay back the student loans and live, right? So, that's a big barrier for individuals. I have a lot of people that I know who are in recovery that have gone through school and got their social work degree, and unless they got in with a government agency or like if they're doing grassroots in your face work, they're not getting paid a living wage. I've been doing peer support for a really long. Actually, STEER was the actual first peer team in this county. Every the peers at the crisis center were built off of STEER, right? But when the county started the peer team, they started paying them like crazy money. And yet, the very first original template was still making like $40,000 a year under another program. So when that program transitioned over to Tree of Hope, me and the county advocated to bring their salary up comparable to the county because it was only fair. Like, I don't want my peers to have to work 3 and 4 jobs. They can, that's where the burnout comes, right? When they have to work 3 and 4 jobs in order to be able to live, to do the work they love, right? It's not fair. The frontline people, the people who sacrifice, it's self-sacrificing because they love the work, but they should be paid a commensurate rate for the importance of the work that they do.
Well said. Any other questions?
So I actually have a question, and it's a sort of a selfish question. In my agency, I'm in the Preparedness and Outreach Division for the Office of Emergency Management, and I'm always thinking about ways that we can better connect with community members. We obviously go to preparedness events, we coordinate preparedness events, speaking events as well. And from our perspective, it's a little bit different than yours, and I wanted to get your insight on how you connect with community members that are struggling with addiction or have family members that do so as well, and like what type of techniques you use to do so, whether it's through social media or, door knocking, things like that.
I can tell you, well, go ahead. You want to go and
No,
take
you
it
go
then?
ahead.
I can tell you with Tree of Hope, we have a social media presence on every platform. We've built connections. We get referrals from the Crisis Center, EMS, Fire and Rescue. We've built relationships. Like when you asked me who I partner with, as a direct result of like putting in the time and energy, meeting people, connecting with people, helping people understand the importance of the work we do, helping people see it, right? As a result, we built a name for ourselves in the county. So a lot of parents walk their kids in. People walk in drunk saying, I want to go to treatment. And you know what I mean? It was slowly over a period of time, but being present in the community, the connection that I was talking about earlier is everything, right? So we can say, we're putting together this program, but if that program's not out in the community and the people don't get to meet them, then it's going to be less successful than the ones that's out here shaking hands and kissing babies. You get what I'm saying? So,
Well, your work is credibility.
yeah.
When you can be referred to other places by a major company, like
Right.
by the state, that's when you
Exactly.
realize that the work that you've put in.
Yeah, we get Department of Justice, the state's attorney's office, they send us people because our reputation has grown.
Can I ask another question? So I think in our experience within our office, we've identified a couple of areas within Montgomery County that we've neglected in our outreach. and we're trying to take corrective actions over the next year or so to reach different communities throughout Montgomery County, and through partnership with other agencies. You mentioned a couple, obviously, Fire Rescue Services, Department of Health and Human Services. They have a lot of divisions. We partner with them regarding numerous outreach events, and we're just trying to think of, like, are there any other communities or any other areas within Montgomery County that you think could benefit from your services?
This one, this community right here. Yeah, I'm from this community, so I understand ground zero of how important it is. And like I said, I'm really grateful that you guys are doing this and shining a light on the substance misuse, because I lived it. You know what I mean? There's so many. My point to you from the last question and this question is your connection should be with the grassroots organizations that make those connections. Like, not government, like you already got the government connection, but you need to meet the grassroots organizations that's actually on the front line.
Okay.
Making them know your name can be very helpful, and they will give you the insight of the light that they need shined on their communities.
So
Yeah.
other than at events like this, where can someone go to find out more information about your organization?
You can come to our website, of course, but the local Behavior Health Administration has everybody on there, the LBHA, and it has all the grassroots programs listed, where our website is treeofhopeassn.com. You can, like I said, it's a drop-in center. You can walk in. Our phone number is 240-390-6405.
Do that again?
240-690. I just forgot it. 6405. 6405.
That's 240-690-6405.
Yes, and all referrals and everything can be made on our website. You can make a direct referral on the website, but there's always someone there to talk to.
Because you never know, there may be somebody who wants to reach out to you.
I hope everybody does.
And absolutely,
Psych,
in our audience.
That's what I
You
mean.
never know.
Yes, that's my right-hand office manager. He's my unsung hero.
First of all, Ms. Rich, I want to say to you, thank you for being here, and I guess I was an across the street neighbor from you at 111 Lee Avenue. I'm sorry I didn't know you and could have helped you, but thank you for raising awareness that we have this in Takoma Park, this issue, and that we need to be aware. I need to be educated. The reason I am here today is because I have a distant relative, not a blood relative, and he's not even in this community. But I know of his circumstances, and I want to help, but it's difficult. He's the brother of my brother-in-law, and he's obviously, to me, at danger of relapsing, and it's hard to know how to help. The best thing I can do right now that I can think of is to pass along to my sister and hope she'll pass along to her husband, who will pass along to his brother, the information I have. But he's expressed an interest in seeing a psychiatrist, which I think is really hopeful, and he's gotten past his addiction to opioids, but he still doesn't have a good quality of life, and he still engages in addictive behaviors, and it just seems to me that he's still kind of in danger. Is it appropriate for me to try to help in any way, and if so, what would any of you suggest?
I mean, based on those details, it's kind of hard to say, but maybe start with a family intervention if it's more than you that's concerned.
Yeah. Okay. Good idea.
I'm going to say yes, because just someone reaching out to you and saying they care can be the start of that conversation, right? No judgment. How are you feeling? Do you know just saying how are you feeling genuinely can spark a conversation that can save somebody's life? right? Because somebody sees them.
I'll piggyback on top of that, just depending on the level of rapport and relationship that you have with him, just letting him know that that door is open and that you are an option. And if he might not be able to see that right now at a certain point, maybe when he is ready to get help, you will be one of the people that he'll reach out to.
Thank you.
Thank you for asking that,
Yes.
because that tells me you care.
Any other questions? Great. Well, again, let's give a round of applause to our panel. It was amazing. Such a powerful topic, and the expertise is very clear. So thank you. That concludes this panel. I believe there's still some resources out in the Emergency Preparedness Fair, and the COPE trailer is still here if you have a minute to check it out. But thank you for being here, and that's a wrap.
And I'm sure if you want to
Thank
talk
you.
to anybody on the panel, they would be more than happy to talk to you.
Most definitely.